Hi, welcome to the Professional Certifications channel. In this video, we will explore common questions asked by JCI surveyors and provide answers on the International Patient Safety Goals, IPSG.
Show me how do you perform hand hygiene?
Performing hand hygiene correctly is crucial for preventing the spread of infections in healthcare settings. Here's a step-by-step guide on how to perform hand hygiene using both alcohol-based hand sanitizer and soap and water. Using alcohol-based hand sanitizer. 1. Apply product. Apply a palmful of alcohol-based hand sanitizer to a cupped hand, covering all surfaces. 2. Rub hands together. Rub hands together, covering all surfaces of your hands and fingers. 3. Rub each part. Rub each part of your hand systematically. Palm to palm. Right palm over left dorsum with interlaced fingers and vice versa. Palm to palm with fingers interlaced. Backs of fingers to opposing palms with fingers interlocked. Rotational rubbing of left thumb clasped in right palm and vice versa. Rotational rubbing, backwards and forwards, with clasped fingers of right hand in left palm and vice versa. 4. Continue rubbing. Continue rubbing until your hands are dry. This should take around 20 to 30 seconds. Using soap and water. 1. Wet hands. Wet your hands with clean, running water, warm or cold, and apply soap. 2. Lather soap. Lather your hands by rubbing them together with the soap. Be sure to lather the backs of your hands, between your fingers, and under your nails. 3. Scrub hands. Scrub your hands for at least 20 seconds. Need a timer? Hum the Happy Birthday song from beginning to end twice. 4. Rinse hands. Rinse your hands well under clean, running water. 5. Dry hands. Dry your hands using a clean towel or air dry them. Use the towel to turn off the faucet if needed. Key moments for hand hygiene. Before touching a patient. Before performing an aseptic task, e.g., inserting in 4, dressing a wound. Before eating or preparing food. After touching a patient or their surroundings. After contact with body fluids or excretions, mucous membranes, non-intact skin, or wound dressings. After removing gloves. After using the restroom. Visual guide to hand hygiene. By following these steps, you can effectively reduce the spread of germs and protect both yourself and your patients from infections.
Tell me, how do you know that these steps are sufficient to reduce risk of HEI?
These steps are considered sufficient to reduce the risk of healthcare-associated infections, HAIs, based on extensive research and guidelines provided by reputable health organizations. Here's why these hand hygiene practices are effective. Evidence and guidelines. 1. Centers for Disease Control and Prevention, CDC. The CDC has established guidelines for hand hygiene in healthcare settings, highlighting the critical role of proper hand hygiene in preventing HAIs. The CDC's guidelines are based on numerous studies demonstrating that hand hygiene reduces the transmission of pathogens. 2. World Health Organization, WHO. The WHO has also developed comprehensive guidelines for hand hygiene in healthcare, known as the 5 moments for hand hygiene. These guidelines emphasize specific moments when hand hygiene is most crucial to interrupt the transmission of pathogens. 3. Scientific studies. Multiple studies have shown that proper hand hygiene significantly reduces the incidence of HAIs. For example, research published in medical journals has demonstrated reductions in infection rates when healthcare workers adhere to recommended hand hygiene practices. 4. Systematic reviews and meta-analyses. Systematic reviews and meta-analyses of hand hygiene interventions consistently show that proper hand hygiene is one of the most effective measures for preventing HAIs. Key points supporting the efficacy of hand hygiene. 1. Pathogen reduction. Proper hand hygiene practices, including the use of alcohol-based hand sanitizers and soap and water, effectively reduce the number of pathogens on the hands, thereby minimizing the risk of transmission. 2. Compliance and training. Training healthcare workers on hand hygiene and encouraging compliance with guidelines have been shown to improve hand hygiene practices and reduce HAIs. 3. Hand hygiene campaigns. Institutions that implement hand hygiene campaigns and continuous monitoring of compliance often see significant reductions in HAIs. Campaigns typically include education, reminders, and feedback on hand hygiene performance. 4. Barrier to transmission. Hand hygiene acts as a barrier to the transmission of infectious agents, protecting both patients and healthcare workers from infections. Monitoring and auditing. Compliance monitoring, regular monitoring and auditing of hand hygiene practices help ensure that healthcare workers adhere to the recommended steps. Feedback from these audits can be used to improve practices. Infection rate tracking. Tracking infection rates in healthcare facilities helps correlate improvements in hand hygiene compliance with reductions in HAIs. Conclusion. The steps outlined for hand hygiene are sufficient to reduce the risk of healthcare-associated infections when implemented consistently and correctly. This conclusion is supported by guidelines from leading health organizations, scientific research, and practical evidence from healthcare settings worldwide.